Hey guys, welcome back to my channel. My name is Tess, if you don't know me already. So this video is very spontaneous. I had some time and thought I would film a video. I want to stay on my once a week grind. It just doesn't always happen these days while I have a business. But I'm gonna do my very best and try to continue with the weekly videos. It is tough with all these forms of social media these days, but YouTube is my favorite, so I don't know why YouTube falls to the wayside compared to everything else sometimes. I don't know. But without further ado, let's talk about today's video topic, which is common skin concerns and how to treat them. I don't have anything written down, so I am literally just going to word vomit on you and think of the most common concerns that my clients ask me about. Thank you guys so much for watching. Don't be afraid to like this video if you like it. Leave a little comment, subscribe for more, and let's get into it. So there are a number of concerns I get asked about frequently, but I'd say the one that probably most people complain about is clogged pores, blackheads, texture, especially around this T-zone area. It's actually very normal to have blackheads in this area. It's typically one of the most oily areas of the face, and the pores tend to be a bit more enlarged there anyway, so it's really easy for them to fill up with oil, bacteria, dead skin cells, makeup, all the things that clog our pores and make them more obvious. So the best way to reduce your pore size is, of course, to keep our pores clean. And one of the biggest tips I have for treating this area is almost like spot treating it and understanding we can treat this area oftentimes a little bit more aggressively than we treat the whole face. So something that I will commonly do is to treat blackheads with, number one, physical exfoliation. Kind of underrated, I think, when it comes to blackheads. Most people will think of your chemical exfoliants, which are important too. But I like to go in pretty often in this area, at least twice a week, with some sort of scrub. I like to use a combination of an enzyme and a physical scrub that will physically dissolve those dead cells, and an enzyme which will digest them. But I like to do a physical exfoliant in that area to really just dissolve any obvious texture. And my second way to treat is with a BHA or salicylic acid. Salicylic acid is my favorite way to treat blackheads. It really works to dissolve that congestion and just is my favorite acid for treating blackheads, whether it's a chemical peel or some sort of toner that you can use in that area. And I find I can use a salicylic toner in this area 3-4 times a week easily. I would not be able to treat my whole face that way. It would just feel too dry. But again, I can go in more aggressively in this area of my face, which is pretty much always oily. To dry out my forehead would be a hard feat. It's really prone to congestion, oil, and clogged pores. So I just have to make sure I'm treating that area really specifically. So those are my tips for fighting blackheads in the T-zone. My second question I get, which can be a similar area, is how to treat clogged pores or bumps on the forehead. So this is one area I struggle with a ton. My forehead just is so prone to that bumpy texture. So again, I have to kind of hit this area a little bit harder with my physical exfoliants, my enzymes, and my salicylic acid, even chemical peels. But something I also notice can contribute is any type of fabric that is going to produce friction and offer heat on the skin. This can result in something called acne mechanica, which a lot of us have experienced. If you've experienced maskne, you have experienced acne mechanica. But we can also experience the same type of acne breakout, which happens from heat and friction on the skin on our forehead. So think about the items of clothing you might wear that could produce that heat and friction with the fabric. So for me, I'm such a hat lover, always wearing a hat. If I go outside, I basically feel naked without a hat. But what this means for me is I have to be mindful. I have to switch out my hat, wear a clean one every time, so every day or every other day, because if that fabric has more bacteria, dirt, or makeup on it, I'm definitely more likely to break out because we already have the fabric rubbing against the skin. So we want to make sure that fabric is clean. Same reason you would want to wear a clean mask every time. And the second item of clothing that I know I wear a lot, which is kind of unexpected, is a sleeping mask. Now, sleeping masks are amazing. I also can't sleep without a sleeping mask. So these aren't items, you know, hats or sleeping masks. These aren't things that I just avoid altogether. I still wear them daily, but I'm really careful about my hygiene around them, keeping them clean, and also treating the area specifically after use. So after I'm wearing a hat or some sort of sleep mask, I always make sure on a weekly basis I'm doing my physical and my chemical exfoliation to get in there and just really treat those clogged pores, which is where acne always starts. Acne starts in the follicle. So those are my tips for the forehead bumps and blackheads, just to be really careful what you have covering the area, because even if it's something like a silk mask, which is definitely the best fabric we could use if you're going to wear a face mask, when it comes to acne prone skin, it's not so black and white. And what might be a great fabric for somebody who's more dry and never struggles with breakouts, if you are already an acneic person and you already tend to produce more oil and you're more prone to those sticky cells within the follicle, us acne people just have to be more careful than the average person. It might be okay for, you know, your roommate Susie to wear the same hat on her run every week and she might never break out, but for an acneic person, that could be a real problem in the lifestyle. So it's just about noticing these things or these habits and noticing what might be affecting your skin, because no two skins are alike. And when it comes to pore clogging or how comedogenic something is, again, it's not always black and white. It can definitely have a little bit of a gray area where you might be thinking, isn't silk supposed to be, you know, great for my skin? Definitely better. But again, if you're prone to clogging and you have a fabric that's sitting on top of the skin for 8 hours while you sleep, that just might be something that exacerbates the problem a little bit. Concern number 3, which we've talked about a little bit, but just to go even further because it's such a big condition, it affects a majority of people at some point in their life, and that is acne. So when it comes to treating acne, there are different types of acne, and acne can obviously be so complex. So this will be a little bit general, but I just want to talk about how I specifically treat acne and what acne really is. So I mentioned it a little bit before, but acne starts in the follicle and it is clogging. So I always show my clients while I'm talking to them kind of an example of what's happening in the follicle when you're experiencing acne, because to your average person, they're just like, you know, I have acne on my face, don't understand it, I just want it gone. So sometimes it can kind of help to illustrate if you are an esthetician. Here's the follicle. We call it a pore, but it's actually a follicle, and inside this follicle is where acne is going to start. whether it's your inflamed breakout, non-inflamed breakout, whether it's a huge cyst or a little whitehead or a blackhead. All acne starts in this follicle, and in this follicle we have our dead skin cells, our oil or sebum, any other debris and bacteria chilling in this follicle. And what happens over time is all of this debris can lead to inflammation. It's an infection, and that can lead to swelling within the follicle, or what we notice as acne. I talk about how I treat acne a lot because it's a method I learned from taking higher aesthetics courses, but I treat acne by making sure I'm covering 5 components with my clients. So those components include, number 1, working on inflammation, because again, that follicle is inflamed. So it's really important to have calming ingredients that are going to, again, calm that inflammation. Ingredients that can offer anti-inflammatory benefits might be ingredients like chamomile or sulfur, so many, but essentially we just want to make sure we're using calming ingredients and not just stripping the life out of your acne, which I know how it is. When you have breakouts, you just want it gone, you want to treat it aggressively, and sometimes, you know, there's a time and place for that, but we need to make sure calming anti-inflammatories are still in the mix, because if we think about all of the acne kits that were around when I was growing up, or, you know, the Proactive or the spot treatments from the Dollar Tree, good times, you know, all these kits that solely focus on exfoliation, stripping your skin, you know, killing bacteria, but there was no anti-inflammatory benefit. And that is so key because, again, acne really starts with that inflammation. Tip number 2 with acne is hydration. So I think when we say hydration, people assume that means drink a lot of water. Of course, we want to drink a lot of water. Of course, that's very beneficial for our body, our overall wellness. It is beneficial in certain ways to our skin because it's good for our body. But when we're talking about hydrating the skin, drinking water topically actually isn't going to be the most effective way to ensure your skin has hydration. The most effective way to ensure that is to use hydrating topicals, ingredients like hyaluronic acid or aloe, to make sure we are binding water to the skin all day. And some people use the analogy of kids trying to go down a slide. With acne, it's similar. We want to make sure the skin has that water content so it can recover, and so that oil that's trapped in the follicle can actually get out. Tip number 3 for acne is oil control. Oil control is so important because oil is just fuel to the acne flame. If you are acneic and you don't control your habits around oil production, so maybe you're sweating a lot throughout the day, or you're just producing a lot of oil on the skin, you may not necessarily have the best hygiene habits or be cleansing your skin in the morning and at night. That's essentially fuel to the acne flame, and it's going to allow that bacteria to proliferate. So oil control is very important, and we also want to make sure we're using products that help to control oil and fight it. So ingredients like a salicylic acid, a sulfur, a clay mask, those can all help with oil control. Tip number 4, exfoliation, probably my favorite. I love a good exfoliation, and again, it all goes back to that follicle. We want exfoliation because that's going to keep the mouth of the follicle open and clear so that oil can get out. When we have dead cells building up on top of this follicle, what's happening? Inflammation underneath, the oil can't get out, and that's where we have more inflammation and more swelling. So we do want to exfoliate regularly, and it's tricky with acneic people because you need to make sure you find the right exfoliant for your skin. I wouldn't recommend, if you have inflamed breakout, cysts, hormonal breakouts, any redness or inflammation around the breakout, that you go in with a scrub that's going to spread that bacteria. If you have non-inflamed acne, you can definitely use scrubs or enzymes that have physical particles to it. I like making sure my physical scrub has a round bead and is not going to scratch the epidermis or lead to those micro tears. As we know, exfoliation is such a broad category. You can have your chemical exfoliants, your enzymes, you can have your physical exfoliants. Those are the 3 types of exfoliants. So really it's just about finding the one that's right for you. I can definitely help you if you are a client of mine and you're interested in finding an exfoliant for your skin, but everybody needs one in their routine, and that will help more water binding ingredients get in, and also, of course, help that oil get out. And last but not least, bacteria. Bacteria is kind of a sneaky thing that can really affect acne. Much like oil, bacteria is fuel to the acne flame. So with bacteria, I think it's very much about lifestyle. With my clients, they all know I'm pretty on them about bacteria. Things like pillowcases, towels, makeup brushes, the cell phone, touching your face with your hands. All of these things can spread bacteria, and our hands are filthy. There's a reason that surgeons literally scrub their hands in hot water before even putting on gloves and going into surgery, because our nail beds and our fingers can harbor so much bacteria. So we want to make sure we're not adding to the problem by touching your face throughout the day. Wipe down the cell phone once a day. With my acne clients, I suggest they change their towel every other day and use a separate one for their face from their body. And same with the pillowcase. Every other night, I say flip it over after one day, and then after 2 days, it's time to wash it, which probably sounds insane. So I suggest having a variety of pillowcases so you can just, keep swapping them out. Even if that's, not something you keep up for your whole life, while somebody is acneic or really in the thick of it, these are the small things that can really add up. And even things like cleaning your makeup brushes, I think we've normalized cleaning them like once a week or so, but we really need to be cleaning them a lot more, because every time you touch your face, you're collecting dead cells and bacteria, putting it back in the makeup, back on your face. So to minimize the problem when we're talking about acne, it's not just about giving the client their products and their home care routine. We also have to talk about lifestyle. The 4th concern I want to touch on is melasma. Melasma can be a really notoriously tricky beast because, one, she is triggered by very normal daily parts of our lives, which we'll talk about in a second, and number 2, it can be difficult to treat that type of hormonal pigment, and what makes it harder is those triggers are so recurring. So it's not something where we treat it once, it's gone. We have to be very proactive and on it when it comes to treating melasma. When it comes to melasma, the main things that are going to trigger it are heat, light, and hormones. So if you don't know, melasma is often called the pregnancy patch, and you don't only experience it when you're pregnant. You can experience it in menopause or when you're experiencing some sort of hormonal fluctuation. So I notice women of all ages can experience melasma, and definitely something I have struggled with myself. I'll be honest. Anytime I'm working out in the heat during the daytime, I'm just very aware that my melasma can flare up at the drop of a hat, because my hormones are always in flux, especially if you are on a birth control any form of birth control really, and you are getting that sun sensitivity to UV light, and you're having the heat from the workout in the sun. So when it comes to identifying melasma, if you're not sure if you're experiencing melasma, you can talk to your dermatologist about it. I would say the main characterization that sets melasma apart from other pigment is it tends to be a pattern or a patch. So melasma can really occur in different areas of the face. I've seen it on the neck, I've seen it on the forehead, on the cheeks, around the eyes. I struggle with the mustache, which is right above my lip. Very common. We're women, and men can get melasma too, but mostly this affects women because, again, our hormones and all of these things that might cause a hormonal fluctuation, and then these other common lifestyle factors like the light and the heat. So when it comes to melasma, again, I think prevention is so key. So let's talk about prevention first, because when it comes to skincare, prevention is always going to be easier than corrective skincare. So a couple things I always suggest if you are somebody who is melasma prone. You really want to make sure you are using tyrosinase inhibitors as well as vitamin C. These are going to help protect those melanocytes from getting too active, which is really what produces the pigment. So we want to keep the melanocytes chilled out, and using tyrosinase inhibitors like a kojic acid or an alpha arbutin or a licorice extract that you can find in a serum. Those are all really helpful, and I like to pair those with vitamin C. So my daytime routine pretty much always includes tyrosinase inhibitors, a vitamin C, and sunscreen. Sunscreen is so key, especially for my melasma clients. If you're not wearing your sunscreen and reapplying it regularly every 2 hours, the work you're doing in the treatment room can be a bit futile. It is so key to the equation. So I would hate for somebody to spend $600 on a Rev Peel or whatever it costs. I'm sure it's worth it because I know how it feels when you have melasma, but the last thing you would want to do is not protect your skin with SPF. Another key component of prevention is keeping the skin cool and calm. Cool and calm is the state of healthy skin, so I think ice rollers and cold tools and cryotherapy are some of the most helpful things for melasma. I really suggest using those cold tools daily, or even using them twice a day, maybe in the morning after a shower, especially if you take warmer showers. Anytime you have been exposed to heat, or even, you've been wearing your fabric face mask, that's a good time to cold roll after, to just make sure, again, we calm down those melanocytes. So if you have melasma, everybody needs a good cold roller, and that way you can just stick it in the freezer, whip it out post heat exposure, and it's like a little self-care moment every time. Let's talk about ways we can treat melasma. So a lot of doctors and some estheticians will say hydroquinone is the gold standard for treating melasma. It is probably one of the most effective ways, and I have no problem with hydroquinone as long as the client understands potential risks that can occur in high doses. So I think the most important thing is being in somebody's care when using hydroquinone and making sure you're staying in the loop with them as far as how long to use it. I know sometimes doctors will suggest 1 month on, 1 month off, but I really just suggest staying in the loop with your practitioner, because I do know of clients who get handed hydroquinone and unfortunately are not advised properly on how to use it. So there's a lot of error that can happen when people are misinformed and not staying in touch with their practitioner. So that's the main thing if you do want to use hydroquinone. You can also use chemical peels to brighten melasma. I think a series of peels works great, possibly some deeper chemical peel such as a TCA or a Jesner's that can reach a little bit deeper into the epidermis. These are all treatments I would do on top of those preventative measures, which would be the vitamin C and tyrosine inhibitors. Retinol is also, of course, a great way to treat melasma. It's not something that's going to be instantaneous, but more of a long-term kind of like playing the long game when it comes to melasma. So retinol is something I would definitely recommend to have in your routine, because we are turning over those cells with retinol, which is eventually going to bring new, healthy, brighter cells to the surface. Lastly, I wanted to touch on tranexamic acid, which has been found to be highly effective off-label when it comes to treating melasma. We are finding that we can use tranexamic acid topically in skincare, and dermatologists can also recommend it in an oral medication. And by the way, I'm not saying that's something I would recommend for any individual. Of course, talk to your doctor about it. It is just an option, and the studies are looking really promising for both topical application of tranexamic acid and oral medication. So I think that's something really interesting, and tranexamic acid is showing a ton of promise, both being used topically as well as orally as a medication. And I was just talking with my derm about it because she actually published an article on tranexamic acid, the benefits for treating and preventing post-inflammatory hyperpigmentation, as well as how it can be used off-label for melasma. I will link that article below for all you skincare nerds, because it is just so effective, and the studies and the photos are pretty amazing, and that's so exciting. That's something I get jazzed about when it comes to the skincare industry, because if we as professionals can understand an ingredient and provide ingredients that drastically improve somebody's quality of life, that's something great to me, and that's something important. And I think melasma, very much like acne, it can be something that affects our quality of life. We might feel embarrassed about it, we might feel like we can't socialize normally, or it affects our confidence. We may not look people in the eye the same way. I'm not saying we shouldn't, but it's just something that can definitely affect us. So very exciting about tranexamic acid, and I hope those tips about melasma helped. Last concern I want to make sure I touch on are acne scars. So I find probably 8 times out of 10, way more often than not, when clients are talking about acne scars, typically they're using the wrong word, which is actually important, because we want to make sure as professionals we're treating the client's biggest concern and what bothers them. So oftentimes you will hear as an esthetician a client say, I'm bothered by their acne scars, and you need to ask, okay, tell me more about the acne scars that you're seeing. Or if you're looking at their skin yourself, you can identify. But when we're talking about acne scarring, that actually refers to a lack of volume in the skin, or a lack of collagen. It might be something like pitting or boxcar scars you may have seen before. Those are examples where we've actually lost collagen in the skin, and you might see those visible indents in the skin. Oftentimes when people are referencing acne scars, they're just pointing out pigment, and that's a better thing because it's a lot easier to treat. Oftentimes when clients are pointing out what they call acne scars, it's really post-inflammatory erythema. So it might be a little bit of redness or inflammation where the trauma or the breakout occurred, or it could be post-inflammatory hyperpigmentation. And typically that occurs with your more fits 3 through 6, where they might have more of a purplish or a brownish mark around their acne spot. I'm a FITS 2. I don't really struggle with post-inflammatory hyperpigmentation. It's more so the erythema or redness. But of course, there are people who are actually struggling with the true scarring. So let's talk about how to treat that. I think it is important to just be real and direct. I think people appreciate that, especially when it comes to wanting to be on the same page and be clear about the results you can deliver. The reason that acne scarring is so difficult to treat is because we're basically trying to make up for lost collagen. And if you've ever had a true wrinkle that's there on the skin at rest, it's more difficult to address because we have to make up for that lost collagen. Kind of like crumpling up a piece of paper and opening it and trying to smooth it all out and make it perfect like it once was. Very difficult, but improvement can be made. So there are treatments that can help with acne scarring. Those are going to be your more serious treatments, microneedling, or even a NanoPro if you're in SD in California, as well as chemical peels, retinol, and vitamin C, even some lasers. All of those things can help with acne scarring by producing more collagen. There are definitely treatments that you can use if you're struggling with acne scars. First and foremost, you're going to want to make sure you're on an effective vitamin C and retinol, and you can pursue those deeper treatments that are going to stimulate the fibroblasts to produce more collagen. These are your deeper treatments like lasers, microneedling, even the NanoPro if you're in California, as well as chemical peels and lasers. Again, these treatments are effective because they're actually going to reach the deeper layers of the skin to produce new collagen, which is what we want. Those are the 5 common skin concerns I hear about in my practice and how to get them treated. I hope you guys enjoyed this video. I hope it helped. Please let me know what you thought in the comments below, and I will see you guys in the next video.